Everybody, and welcome back to another episode of the Global Health Uncensored podcast. On this platform, we speak to the leaders transforming global health from the inside out. I'm Dr. Banda Khalifa, and today's guest is one of the most important voices in global health policy and equity. Professor Madhukar Pai is the inaugural chair of the Department of Global and Public Health at McGill University and a Tier 1 Canada Research Chair in Epidemiology and Global Health. He's a fellow of the Royal Society of Canada, a fellow of the Canadian Academy of Health Sciences, and was a founding editor-in-chief of PLOS Global Public Health. His research has shaped policy and practice worldwide. He serves on advisory groups for the WHO, FIND, and several NGOs. Today, we are digging into the state of global health, why funding is drying up, who gets left behind, and how education, mentorship, and narrative power can build the next generation of global health leaders. If you want to understand what's happening in global health and how to change it, this conversation is for you. So let's dive right in. Professor Madhu, thank you so much for joining us. It's been a pleasure. I know I've been trying to get you on the podcast. Thank you and welcome to Global Health Uncensored.
Thank you so much. Really happy to be here.
All right. So I always like to go back to where everything began or where everything started. So what were your early experience in medicine like, and how did they push you towards public health?
Thank you. Great question. So I was born and raised in a small town in South India, and I was very, very lucky to get into medical school. But somewhere along my, I think, third year of medical school, I started wondering why everything that was being taught to us in med school was only about taking care of sick people. Why there wasn't enough attention given to preventing diseases, especially in a country like India back then, with so much morbidity and mortality that was preventable. So then I happened to get involved with the medical health activist group in India, which still exists 50 years later, called Medico Friend Circle. And attending those events and meeting some amazing people working across India in rural areas, in underserved communities, real heroes, made me wake up to the whole world of public health, community health, social determinants of health, and health inequities and health justice. So when I finished my MBBS training, I broke all traditions and people thought I had gone mad. I willingly, wantingly chose to do public health residency, which in those days was seen as extremely radical because why would anyone who could do cardiology or surgery, why would they even care about doing public health? So even my own professors thought I had completely lost it. But I do not regret that decision at all. I did my residency training in community health at an absolutely stunning, remarkable place called Christian Medical College in Vellore. And wow, what a training that was. 3 years of immersion into community health, clinical work that is relevant to community health, investigating outbreaks in villages, you name it. I did it all. And I think that really set me up in my career. Then I was lucky to do my PhD in epidemiology at Berkeley. And then I've been here in Canada for almost 20 years as a professor.
Awesome. I mean, your trajectory is similar to most physicians who, try to go into public health. I also remember one of my lecturers back in medical school met me a couple of years ago, post-medical school, and was asking, so what are you up to? And I'm saying, I'm currently doing more of public health. And I say, oh, you people don't know how to, you always want the easier path. Instead of you to come and do surgery and do public health. And I'm like, oh no, it's public health in detail is much more challenging than, surgical skills. So that is
more so now. Look at all the public health people under attack, literally being shot, shot at, and death threats. And yes,
Yeah,
extraordinarily
it's
difficult time to be doing
yeah,
public health.
it's
We
really
really
tough.
should.
Yeah,
Yeah.
and your path took you from India to UC Berkeley, then to McGill. What did each of these stages teach you about how global health really works, or how public health really works?
Well, when I was doing my residency training in public health in India, I never called it global health. I
Mm-hmm.
just did whatever I needed to do, right? So I took care of people with TB. I ran a leprosy program in our villages. I did antenatal care. I did not even think about any of that as global health. In fact, I didn't even know what global health was. Suddenly, when I moved to Berkeley, then my work on TB in India, which I did my PhD thesis on TB in India, suddenly what I was doing got called global health, which itself is a very interesting way of thinking about it. So, at some level, you may say global health is a global not invention, because most of us, when we do routine healthcare or public health in the global south, we never call it global health, right? It takes on a different meaning when it is done by somebody else coming to our country. So
Mm-hmm.
that itself is an interesting tension within global health, right? If
Yeah.
I just did routine public health in India, is that called global health? If you did routine public health in Nigeria or some place, is it called global health? Or is it only global health when you go from Baltimore to Nigeria to do the same
Yeah.
thing? So
Mm-hmm.
it's an
Mm-hmm.
interesting
Mm-hmm.
tension. But what is unique about the fact is that ever since I left India, whether it's my time in the United States or all these years I've spent in Canada, much of my work still happens in India. It still
Mm-hmm.
happens in
Yeah.
Africa, still happens in Peru. I've never really stopped working in the global south. Yes, physically I'm based here, but much of my work and my passion still remains where I think it's needed the most. So
Yeah.
to that extent, I feel very motivated and happy when I'm doing stuff in the global south because I can see the visible need for that work.
Mm-hmm.
I also feel happy that my knowledge and talents are being put to good use there.
Yeah, yeah. So you, as you rightly said, like after Berkeley, you moved to Canada, and you've been in Canada for over 20 years. You are now
Nearly
the
20.
inaugural chair of Global and Public Health at McGill. So what's what what's your mission for the department? If you could maybe summarize in a sentence or two, what do you really want to change as a chair of Global and Public Health at McGill?
So it's a new department, but I think the core for me would be aspirationally to address some of the biggest health inequities in the world,
Mm-hmm.
locally, nationally, and globally, right? So to me, it's there are also underserved communities in Canada. There are also underserved communities in the global north. So I want our department to care about that, right? Local public health,
Mm-hmm.
national issues, but also globally. And I think again, as Paul Farmer said, global health by itself doesn't mean much. It's inequities in global health that truly motivate us and should
Yeah.
motivate all of us. So tackling global health inequities locally, nationally, and globally would make me very happy as a mission for the department.
Awesome. Awesome. And I mean, I think you're doing an amazing job. I've had opportunity to follow your work for a while, and I can say that the voices that are in global health that really are trying to push things, push change, change the narrative. You are likely one of the main thought leaders. Surprisingly, as you said, many people stop at research, and you've moved into influence. You're editing journals, you're shaping education, advising policy. What made you kind of shift a little bit from purely academic standpoint to more of an advocate?
So it's a wonderful question, I must say. I think what happens is I think I'm generalizing to other people like me as well. When we are young, we care more about publishing in good journals, getting
Yeah.
grants, and whatever. But as we grow older, when the amount of time we have left in our careers starts shrinking, right? I don't know how many years I have. Maybe I'll have 10 years or 15 years at best. You really don't get a lot of pleasure out of another publication necessarily, right? You start asking, have I made a difference in this world? In what way am I making an actual impact? Am I changing anything, right? So yes, researching tuberculosis, for example, was a passion, is still a passion. But if all my TB research and publications don't really change the burden of TB in any way, that I'm not actually helping solve this TB epidemic in some ways, then I ask myself, what's the point, right? I want to be part of the solution. So you do tend to get more engaged in advocacy, in policy, in trying to change reality. And I think that is a great way to stay motivated. Otherwise, I think pure research alone, I'm not sure how many years it can keep us happy. We need a we need a bigger purpose. And the
Yeah.
purpose, researching TB is a purpose, but trying to end TB is a better purpose, I would say. And I
Yeah.
want to get
Yeah.
rid of this disease, or at least I want to help contribute to getting rid of this disease. The other reasons for advocacy would be like TB. It's a disease that is still largely neglected, right? So if you
Yeah.
think about, if TB had affected rich countries or privileged people, would we still be using a 100-year-old BCG vaccine today? Right? You look at the amount of money that was spent on COVID vaccines and the speed at which it moved.
Yeah.
TB doesn't even get a tiny, minuscule fraction of that. So I've always advocated for more resources for TB. But I think my advocacy in general kind of really blew up during COVID-19. I kind of knew that when vaccines were being developed, I kind of had a bad feeling that the global south was going to get left out. And I was
Yeah.
looking at warnings from colleagues working on HIV/AIDS, right? They said, watch out. We've seen this drama play out
Before.
before. It's going to be pretty bad. And I did not know how bad it was going to be. And then when India literally collapsed in the Delta variant, I mean, in 3 months, 3 million plus people probably died in India, and the Delta variant hit the country. That's when I kind of woke up and I was shook, so shook in terms of how devastating COVID can be among unvaccinated people globally. I started more vocally getting involved with COVID vaccine equity advocacy. And today I'm still advocating, given the devastation that the Trump administration is causing the whole world of global health and development. So I think I'm very comfortable in, if somebody called me a researcher, scientist, physician, and advocate, I would happily accept that label. I would have no problems with that.
Yeah, yeah, and I think that's extremely important, as you rightly said. There's so much we know, but it's so little that we've done to actually bridge that gap. So advocacy, I believe, should be part of the core training of public health, for students to go beyond just getting excitement of publishing papers. So that's a wonderful end to our segment. Okay, and I think one other thing that has become the topic of discussion these days is the state of global health, and I can't find any better person to tackle this issue than you, because you've been doing a lot of work in this space. So I want us to look briefly into the current state of global health. We are seeing major cuts in global health funding from USAID to NIH. Even some NGOs are pivoting. What are the real implications of this for the global south in particular?
Yeah, I mean, I must say, since January of this year, every passing day has been quite catastrophic for global health, humanitarianism, multilateralism. I think the impacts are so deep and profound, right? Yes, as you rightly said, the immediate impact comes from all of the funding cuts, not just by the United States government, but also many other Western nations are suddenly giving up on their obligations for development assistance. Forget reparations for colonial damages. We're not even close to even thinking about that right now. But even the tiny amounts of money, tiny compared to their GDP
Yeah.
of these countries, even the tiny amounts of money they were giving for all these years has suddenly become a big burden for them. And to me, it boggles my mind as to how the bottom has fallen off in that way of thinking, right? America first, Canada first, UK first, whatever it is, that en masse, the global north is kind of reneging on our responsibilities to the rest of the world, almost as if we were not connected with the rest of the world in some ways. And so the immediate effects of these funding cuts are visible, right? Kids are not getting HIV medicines anymore, or women are not getting reproductive health services anymore. Contraception services are not reaching people. Immunization coverage is dropping. There's all this immediate, instantaneous effects of shutting down massive programs. But there is also a more sinistrous trend of normalizing this self-centered nationalism, right? If it is not relevant to America, then we don't care about you. If it's not important for our, national policy or trade or whatever, everything is now transactional, right? What is in it
Yeah.
for us? Why should we do this for you? And even more sinistrous things in terms of exiting all things multilateral, right? Exiting WHO, exiting the Paris Agreement, not supporting even sustainable development goals, which all countries, as you know, endorsed SDG years ago. So it's just normalizing this way of thinking that every one of us is in this in world by ourselves. We are all islands. We don't care about others, and it also links to this whole growing movement on pushing back against immigration, against
Yeah.
refugees and deportations and mass deportations. I don't know how on earth we got here, but we've gotten here to a very dark place very, very quickly. And it absolutely terrifies me that all things good can disappear in a matter of months if one is not aware of it or one is not prepared to fight for it. Democracy itself is rapidly eroding, right? And when
Yeah.
democracy erodes, what else will stand, right? If you're not even able to make an argument on the rational basis that we are all connected, and the pandemic proved us, right? The pandemic showed how connected the world is. And it's like we've all slept through the several years of the pandemic, and we're not even understanding that what starts somewhere will come here, and what
Yeah.
starts here will go somewhere else. So it's a massive regression of humanity, I would say, regression of our empathy and compassion for fellow human beings wherever they happen to be.
Yeah. Yeah. I mean, you've summarized it in a very beautiful way. We've seen this before, and it's gonna happen again. COVID will not be the only pandemic we'll deal with in our lifetime. And to see the changes, intentional crackdown on global health structures is a bit disheartening. And I know you often talk about, global south and global north. But how does it feel as someone who is in the front lines? How does it feel to be told to build like local capacity when really the money, decisions, and timelines are still controlled elsewhere? How does that change your or your perspectives?
I think there have been so many interesting pieces that have come out in the last year. We wrote something in Lancet last year on shifting power and global health. I have no doubt in my mind that the future of global health does not rest in the global north. I think the global north is in a state of moral decline. I'm not seeing great enlightened leadership in the global north. I genuinely think the time has come, more than come, for global south to step up big time take ownership of their problems, exercise the agency that they already have, and invest in self-sufficiency, self-reliance, and self-determination. Yes, on paper it sounds the right thing to do, but I'm also not naive. I am aware that many global South countries are drowning in debt, um, that they have limited resources, and it's not easy for them to come up with the resources required to fill this big holes left behind by the international structure collapsing. Long ways to go, but I take hope that some of the countries that I knew were, aid dependent 20, 30 years ago are no longer aid dependent today. The Indias, and the Chinas, and the South Africas, and the Rwandas, and the Thailands, and the Indonesias. There is hope. Countries are progressing and becoming more and more self-reliant. And I would love to see, Africa Union's strategy come to fruition of a new public health order that is led by Africans with African investments and manufacturing in the Africa continent would all make me happy that this isn't just a dream, that it is still feasible within our lifetimes.
Yeah. I can't. I mean, this is one topic that really frustrates me, because I mean, if you've stayed in, you stayed and worked in Africa before, you kind of know that if our leaders or our governments are really serious about health in general, they'll put more resources in health. The kind of projects they put money into, it's surprising to kind of circle back and say, oh, we don't have the resources to invest in health. So as you rightly said, this time may perhaps be the turning point for our leaders to know that, okay, I think it's about time we stop asking and stop investing in our own health infrastructures. And I think one other area is that as funders scale back, and the North is retreating, what models should we be building to make health systems and the global South less dependent and more resilient? Who should step up? Is it like philanthropy, our governments, or new regional alliances?
I think governments are key, and then South-South solidarity among governments is also key. I would be very nervous about relying on philanthropic investments because, as we just saw, philanthropy can disappear overnight. Um,
Yes.
and we should all be fighting for fair taxation of wealthy people, and less about rich people coming to save us. Most rich people do not care, to be honest. So I think a progressive taxation of wealth is the right strategy for both the global north and the global south. Um, I think governments, while global south countries, as you know well, may not necessarily have a lot of cash, what they have in plenty is incredibly talented people, right?
Yeah.
Uh,
Yeah.
People are the biggest resource imaginable in the global South countries. When I go to India and I see 1 plus billion people, there is enormous talent. When I visit African nations, I see how much potential there is, right? So we need to find a project that truly unlocks the talent of our people in the global south, right? And that of course requires enlightened leadership who will harness that talent, which is why I said, even in my most depressed moments, I do know that the India that I left years ago is not the India today. The India today is not wanting anybody's aid, not wanting anyone to come and help. It's more than capable of taking care of its needs. I think that evolution tells me that it is possible. If India can do it, so can others, right? And also, while small countries may or may not have the ability to manufacture stuff, forming regional alliances. And I think that is where I think Africa truly stands out for me, because the Africa Union, Africa CDC, they all give me hope that collectively they may be able to do things that individual countries may or may not be able to do.
Awesome, awesome. Um, let's shift attention to another important topic. As we are all aware, the current shake in research and global health is also trickling down to academic institutions and funding cuts and all that. So I want us to look at how global health education itself, is being impacted and what we can do about it. And I know you've worked across continents, India, US, and now in Canada. What frustrates you most about how global health is currently being taught in our institutions?
Um, Great question. We recently wrote a thought piece along with my colleague Shashika Bandara, who you might know, in PLOS GPH of what we call the red pill versus the blue pill version of teaching global health, right?
Mm-hmm.
I think when I first taught my Global Health 101 course at McGill about 11 years ago, I primarily taught about disease burden. I taught about TB. I taught about the science of HIV, so on and so forth. I don't think what I taught back then, which I would now today call a blue pill version, because I was apolitical, I was
Yeah.
ahistoric. I did not bring the right historical perspective. I did not interrogate the politics of why things are the way they are. I certainly did not dive deeper into the social and structural determinants of health, the racism that underpins a lot of the policies that we see and we die off. So I think today, if you ask me, my global health courses are more and more looking like the red pill version, right? We
Mm-hmm.
talk about politics, we invite politicians to come into our classrooms, we invite people to come and talk about wealth concentration and why economic inequities matter. We have entire lectures on the colonial history of global health. So, progressively, the courses that I teach have become more and more um, activist, if you wish,
Okay.
because the world has gotten darker in many ways. We saw the pandemic, we are seeing an extraordinary number of conflicts raging around the world. People are dying when they don't need to. We are seeing this current catastrophic cuts in aid. We are seeing climate crisis accelerate. So as the world has gotten darker, I would say, my global health courses have become darker, but my way of framing global health has changed. So I don't hesitate in telling my students that the world is in a bad place. Things are dark, but I also give them hopeful examples of people and movements that have dealt with dark times in the past
Yeah.
and have managed to change things around, whether it was the devastating AIDS epidemic that required immense activism to turn the ship around, or whether it's civil rights movements or other human rights movements that have successfully dealt with bad times in the past. So I think showing students some hope on how they can organize themselves and be parts of bigger movements, whether it's climate justice movement, whether it's the anti-war protests or protests against gun violence, whatever it is that they are passionate about, that there it is possible. And I also try to bring inspiring people who are part of these movements to come and talk to my students, so that they leave the semester feeling, okay, things are bad, but I can be part of the solution. I don't have to accept the bad part, that I can go and change the reality, not by myself, but by working with others in groups, in communities. That to me is the tone that I'm starting to adopt. So
I love-
if you ask me, global health education in the global north is still taught primarily from a very savioristic lens that we, the
Mm-hmm.
global north, know everything. We have the money, we have the smart people, when we will go and solve the world's problems somewhere else. I think that tone has to dramatically change now, more so after what has been happening in the last 1 year. I think global northerners have to be very humble and say, this is not our battle to solve. I'm not going to end malaria in Uganda or TB in India. Ugandans have to end malaria in India and Uganda. Indians have to end TB in India. But they know what to do. They are more thoughtful and experienced than I will ever be. But if they invite me as an ally, I can show up with whatever expertise I may have and be part of their stand in solidarity with them as they struggle and solve whatever crisis that they have on their hands. So I'm teaching my global north students to think as humble allies and not as leaders. And I
Yeah.
think that's a huge shift from your
Mm-hmm.
education at Hopkins or my education at Berkeley. We had this arrogance that we would solve the world's problems, right? Because we were Harvard or Berkeley or Hopkins. I think our tone absolutely needs to change and shift towards a more humble approach, that this is not necessarily our battle. We are not necessarily the most knowledgeable. People who are dying every day of malaria are way more knowledgeable about malaria than us. We
Yeah.
need to be more humble listeners and allies.
Yeah, that's an amazing thought. And oftentimes, as you rightly said, they come in as experts when there are people on the ground who have been working on the same issue for a very long time. So I have some small, like a trivial, a funny question. So who really gets to call themselves like, oh, who gets to be seen as a global health expert? And how do we kind of challenge that credential hierarchy that often sidelines global South professionals?
Absolutely great question. And I think I already started answering it. I
Mm-hmm.
think for too long, we've been defining a global health expert as someone who is highly educated in the global north. Your Harvard professor or your USAID expert in Washington, D.C. I think that phenotype of a global north highly educated person, usually mostly male, mostly white, has become the prototype global health expert. And for centuries, I would say, from colonial times, that has been the image of a global health expert. And I think if you ask me today, the complete different perspective of that would be a global health expert is the one who has the most lived experience in that area, right? So if it is women's reproductive health in Latin America, then Latin American women who are working on this on a daily basis and are seeing the suffering and the needs there are probably the most um, biggest experts in that field. So I think it takes a lot of humility to shift this frame away from the global north, decenter from the traditional global north experts, and to global south. Even within global south, the most disadvantaged, marginalized, impacted communities are the biggest experts, even within the global south. And so listening to them requires us to truly indulge in an act of humility, right? Our PhD at Berkeley or Harvard or Hopkins does not magically confer
Yeah.
expertise that we have not really earned. I'm not saying our PhDs are irrelevant. We learned a lot, we did a lot, we earned it. But I think the most impacted people are the ones to tell us what is wrong and what can be done about them, right? We can never be bigger experts than them. So there is a beautiful paper in PLOS Global Public Health by Chiamaka and others called Who is a Global Health Expert, that I would
Expert.
highly
Mhm.
recommend to everyone. Yes.
Awesome, awesome, awesome. Well, I mean, since we are on global health education, I want us to talk a bit about the experience at McGill. Um, I know I myself, I applied to McGill a couple of years ago, but I couldn't join. But I know like a couple of my colleagues who have been through the program and they speak highly of the program. How has your experience been teaching and leading in McGill for, say, it's almost 20 years? How's the environment like, and what
So
you
we're trying hard. I would say McGill is no different from most global north institutions, right? It takes a lot of effort to change how we do things. Like I said, my own global health class, which I started 11 years ago, is vastly different from the way I teach it today. So it's a work in progress. But where I think we could make a reasonable impact, I would say, is that we started a summer institute in global health more than 10 years ago. And huge numbers of people from low and middle income countries have benefited from them because we have a lower fee structure for low and middle income countries. We give lots of fee waivers with a lot of effort and intentionality that we've put into it. Um, thousands of people have taken short courses of various types in our summer institute. I'm very, very gratified by the impact that we could make. Despite being a global north institution, we could find a way to make our programs more equitable and accessible. We are just opening admissions for a Bachelor of Arts in Population and Global Health at McGill. And I'm hoping that this program will also reach a lot of people who need it, and will have equity at the heart of it.
awesome, awesome. So, I want us to dive straight into the element of mentorship and leadership in global health because they go hand in hand with global health education. Um, what does meaningful mentorship look like in the global health field or in public health? And at this point in time, how often do we actually see that?
So, mentorship, is hard in the sense that generally mentors are for life. You need to develop a good relationship with them. You can go back to them throughout your career. I go back to some of my mentors even
Mm-hmm.
after decades, right? Even though I'm a chair, I still need advice. So mentors are very few, hard to find, but once you find them, you should try hard to keep them for life, right? um, but what I think is a lot more straightforward and fairly easy to do, I would say, is being a good sponsor, right?
Mm-hmm.
So let's
Yeah.
say I get an invitation to give a talk. Do I really need yet another talk on my resume? Do I need yet another editorial on my CV? So finding ways to redirect the opportunities that come to me towards people who generally don't get those opportunities. I'm talking about women, I'm talking about young people, I'm talking about people in the global south. I think that is something that privileged people in the global north can do a lot more than they're doing today. There's really no reason why we can't be better sponsors. And I think older men have a huge responsibility here because we keep on getting asked to do all sorts of things and to get our names on yet another paper, yet another award, yet another talk, yet another panel, yet another keynote. We can absolutely say, thank you, but, can I suggest someone who's even better than me because they really have the right expertise you're looking for? And I think leaning out and vacating the space for others is a great way of being a good sponsor. And I think that is something I'm now comfortable in doing, and I do often. The second thing is to do is when I write, for example, I have a column in Forbes. When I quote people after interviewing them, I intentionally seek quotes from Global South colleagues. I
Mm-hmm.
intentionally seek quotes from young people because they never get asked, right? They never get asked. We're always quoting each other here in the global north, and men are quoting more men. So I think at some point we need to break through all of this, right? So by just thinking for a bit and saying, why am I quoting all the men around me when I have such amazing people all over the world that I could tap
Yeah.
into? So by intentionally and thoughtfully, what shall I say, decentering all my pieces away from the typical global north structures, I think we can do great work in giving a chance to people that normally will not get that chance. And I can assure you, they deeply appreciate it. Right, for them, it's a pretty big deal to be asked, to be invited, to be given an opportunity, and it also shows them, well, somebody is trusting me, right? Somebody is
Mm-hmm.
giving me a chance. That means I am able and I am capable. I think all of us, I do remember, being in the global south and waiting and wanting for a break in my life, right? So I know for a fact that somebody took a chance on me when they accepted me to do a PhD, or when they
Yeah.
accepted to fund me. And I think every one of us at some point in our lives needs someone else to believe in us, right? To say, hey, I know you can do it. I am giving you an opportunity, take and run with it, right?
Yeah.
And that's about all we need. We need one door to open for us. And if we are good, we take that door that is cracked open and we make something out of it for our own sake. I'm sure you being given a chance to train at Hopkins has been life changing for you, right?
Mm-hmm.
So each of us want nothing more than someone to believe in us, to tell us you matter, right? and
Yeah.
and we know you're capable of this, and I'm giving you this opportunity. Right now, what you do with it is all up to you, but that's your break, right?
Yeah.
So
Yeah.
I think the best definition of mentor that I've ever read in my life is in a publication in the New England Journal of Medicine. It says something along the lines of, a mentor is someone who has more imagination for you than you have for yourself, right? So they can see something in you that
Yeah.
you at that stage in
No,
your
yes.
life
Yeah.
just cannot see, right? I don't know what I saw. I didn't see much of myself. I didn't think I was good. I didn't realize what I was capable of. Somebody had to tell me, I think you're destined for something bigger, right? And I know you can do this. Here, go and pull this off for me.
Yeah.
I think that mere confidence and faith they put in us when we are probably nobody, right? When we are nobody, somebody picks us out and say, hey, I have great confidence that you're going to do something with us. That to us is like everything, right?
Yeah.
So somebody had to tell me, no, I know you're capable of doing a PhD. I know you do well. Here is the opportunity, admission and funding. Take and run with it. That to me is genuine mentorship. And and true mentors take a chance on us when we are a nobody, right? Not when you become something. When you've achieved a certain thing in your life, then if somebody wants to mentor you, that is not that helpful for me. You
Yeah.
have to mentor someone when they genuinely have nothing, when they think they are nobodies, right? Because that tells you that you're not doing it for any personal gain, right? When we are nobodies, when somebody invests in us in whatever way they can, that is the highest form of mentorship, right?
Mentorship.
Because you don't know what that person will one day become or be capable of doing.
Yeah, yeah. And I know like you've mentored, hundreds of students. How would you say it's one mistake that you see in, let's say, early career researchers or even graduate students who are seeking mentorship?
I think first of all, I get lots of emails from students wanting to, come and work with me, or want to be supervised by me in the PhD program, a master's program. What I think they don't realize is that the fit with the professor's area of work or research is absolutely paramount. So when somebody writes to me saying that I work in adolescent mental health, and I really want to come and work with you, how on earth would I really help them? I don't work in mental health at all. So I have no grants in mental health. I have no training in mental health. I'm incapable of supervising someone in mental health. I send them a very quick no, right? So I just cannot help you if your work does not coincide with my research program. So the first thing you do when you're seeking supervision or mentorship or opportunities to train with someone is to do a proper search of that person. Don't randomly write to people. Don't write mass emails. Don't write anonymous dear sir with no name, nothing. Have a very tailored, targeted approach. Dear Professor Khalifa, I know you work in this specific area. I have read your papers. I work in this area myself. Here is my paper or two. Here is what I did in this work. With this, I think there is a terrific synergy between your work and mine. And therefore, I hope you will give me an opportunity to train. Now, if that kind of a person comes to me and who's already doing a lot of work in my area, and if I have a
Yeah.
grant, if I have a big grant in that area, then it is so easy for me to accept that person and plug them into my research program, fund them through my grant. Everything is easy and straightforward. So typically, that's the kind of a person that I've agreed to supervise for my PhD or master's. Never someone who randomly writes to me in a completely different area. I just cannot invest in anyone
Yeah.
because I myself either don't know about that area, which makes me a very bad supervisor, right?
Mm-hmm.
Or
Mm-hmm.
what am I going to do in adolescent mental health or gender violence? I know nothing about gender violence. So, how could I supervise you, right? I just can't. But even if I want to, I don't have the money to support you because I don't have grants in that area. So, the
In that
whole
area.
thing
Yeah.
is worthless to chase. So, I would be delighted if young people not just shoot off random emails to 5,000 people without thinking. Instead, did a little bit of research. I mean, you're
Yeah.
not that busy, right? At that age, you're not that busy. You can afford to do a proper investigation. You can afford to go with people with some clarity on what their area is, what your area is, and what is the connection between the two. The other advice I would give is be a part of a group which absolutely encourages collaboration and discourages competition. So within my own research lab, it's one of the only rules that I have for many, many, many years. I tell all my students no competition within this group.
The group.
You
Yeah.
can compete, right? McGill can compete against Hopkins. I have no problem with that. But I don't want anyone in my team competing against each other.
Each other.
This isn't
Yeah.
a race, right? I say just never even think of competing with each other. Instead, collaborate with each other, be on each other's project, be on
Mm-hmm.
each other's papers, support each other in every way you can. And your own productivity improves and thrives, and boy, what a difference it makes for
Yeah.
trainees
Yeah.
when they hear it. Their blood pressure goes down. They're very calm. They're very happy. The whole group tends to thrive. So this is an absolute stunning, stunning recommendation I would make to every PI.
Mm-hmm.
Never ever have people within your lab compete with each other.
Competing.
It's a
Yeah.
disaster because then they are, bitching behind each other's
Yes.
backs and they're
Yeah.
out
Yeah.
competing each other. It is just vicious. And that politics will never succeed in the long run, right?
Yeah.
So one of the best things I did years ago is to say zero competition here, right? You compete globally if you want to, but not within this team. And that has made a magnificent impact on the lives of all the people who've been through my team. And many of them are still in touch with each other. They're still working with each other well
Yeah.
past the time that they spend at McGill. It's a magnificent strategy that every PI can adopt instantaneously.
Yeah. And I think it's really, really important. And this can be replicated in a lot of areas. Even looking at the other day, I was saying our educational system, for example, in Africa, once you start from kindergarten, everything is about competition. You're out competing your classmates. You're finding ways to be the only person to come up on top. You're hiding resources. So this level of training, competitive training, takes you or follows you up into your professional, environment, and you still keep competing. And that is one of the reasons why I feel most of the time we are not being innovative, we are not creating things that are changing lives, because all we know it's being the first person or being the second person in a class. So
Absolutely. I
that,
mean, growing up in India, I was competing all the time to even get into medical school. But
yeah.
you and I know that global health and public health is a team sport, right? Not, no one of
Yeah.
us has any opportunities for impact. Everything we achieve in global health and public health is as teams. So I think learning how to collaborate with each other and being comfortable with that model, that yes, I won't be a first author all the time. I don't need to be, right? Sometimes my job is to be a really good third author, which I will,
Yeah.
right? And that sometimes it is not our names that appear on the slides. That's still fine, right? We are still
Hmm.
making a contribution, we're still making a difference. Just calming down your trainees and telling them we have a bigger purpose than just publishing, that we are trying to actually help end TB. And sometimes you do things as a service, right? You do a service to WHO if you are invited, and you don't worry about your name, right? Because we
Yeah.
are trying to change policy, we are trying to influence countries in terms of how they're doing things. So our names don't need to be there, right? Sometimes our work is one of allyship and one of service, and it's not about us all the time. That is a nice way to motivate students, I think.
Yeah, yeah, I think that's well said. So before we go, I know there are graduate students or prospective applicants who will be watching this episode. Um, is there any particular scholarship or funding opportunity at McGill that it's unique, and I know like Harvard will have like the Harvard Presidential Scholarship, Hopkins maybe the Summa Scholarship, Oxford will have a similar one. Is there like a unique scholarship in McGill that often goes to talented students?
Yes, I would say I would talk about three things. One is a program called the McCall McBain Scholarships.
Okay.
McCall McBain is for master's level students from around the world. Full funding, tuition, stipend, the entire package. Extremely competitive and rigorous screening process, but we get amazing talented people from around the world, right? McCall McBain Scholarship.
McCall
Second
McBain.
is
Okay.
Mastercard Foundation, right? As you know, Mastercard
Yeah.
makes a lot of investments, and right now we've received a lot of funding for a project focused on Ghana. It's focused on Ghana, and it's focused on nutrition, food security, and agriculture. So we will have lots of opportunities for Ghanaians to come and do postdoctoral fellowships and stuff like that, right? And the collaborative is called Inkaboom,
Okay.
Nkabom, Inkaboom Collaborative. Anyone can Google it, and you will find it. And the third thing is, as I said, our summer institutes in global health will be launching next summer.
Okay.
Registrations will open by end of this year. Lots of short courses will be on offer, and we will have scholarships for waiving the fees for colleagues from low and middle income countries.
Okay. All right. Thank you so much for highlighting that. Well, it's been an amazing conversation, and I'm really excited that you were able to make it to our podcast. But before you go, any last words to African leaders, graduate students, advocates, anybody at all?
I think the just the last word would be to say that things look very difficult now, and I must say it's been very soul crushing to watch all the crazy geopolitics and destruction of systems and humanitarianism and multilateralism. But at the same time, as bad as things are, I don't think we can afford to give up. We really, really have to be involved and engaged, and the only way I think we can survive this is to fight for a democracy, to be part of people's movements, to be part of efforts to organize each other, and to be part of a collective effort to push back against many of the regressive policies and actions that we are seeing unfold right now. So I think hope is not something we're going to sit and passively get. We have to actively work on it to remain hopeful, right? So therefore, let's do something. Let's do anything that'll give us hope. Small acts do add up, and I think we've seen historically how important small acts, when they accumulate over time, can truly be transformational. So don't give up. Keep going.
Thank you so much for those wonderful words. Don't give up. Let's keep working. This is yet another episode of the insightful conversation that we had. If you're new to this channel, you can check up Global Banda Global Forum on Apple Podcasts and also on Spotify. You can also subscribe to our YouTube channel, Dr. Banda Khalifa. You can follow us on LinkedIn. Also follow Professor Madhukar Pai on LinkedIn and on Twitter. If you want to learn more about global health and how you can also contribute to this fight. Thank you so much for joining us. Until next time, bye-bye.